Hello, we are Section 18, Team 1, and we will be discussing criteria for evaluating the legitimacy of clinical trials on arthritis found on NIH's clinical trial database, as well as discuss 2 current clinical trials that appeared legitimate.
Rheumatoid arthritis is an autoimmune disorder in which the synovium, the membrane lining of bone joints, is attacked by the body. The inflammation and changing of the membrane has adverse effects on the functioning of the joint and causes soreness and pain for the person. Small joints like fingers and wrists are generally the first to be affected, and if left unchecked, the inflammation can distort and destroy the joint. Current treatments are focused only on the symptoms, not the cause, and try to reduce the inflammation and pain experienced. Physical therapy can help slow the progress of the disorder. Like rheumatoid arthritis, osteoarthritis is an affliction of the joints with similar symptoms, but different pathology. In certain cases, the cartilage of high-stress joints can wear down, and the destruction of the joint can trigger the immune system to attack the lining of the joint. This worsens the condition and furthers the damage. Again, the only treatments are symptomatic.
Several criteria were developed in order to gauge how legitimate clinical trials dealing with stem cell treatment for arthritis were. One initial indicator is the sponsor and location of the research. Often, legitimate clinical trials were sponsored by medical clinics like the Mayo Clinic, the NIH, or research universities, while illegitimate clinical trials were sponsored by locations with words like treatment center, pain center, or clinic in the name. However, private pharmaceutical companies may also be legitimate, so further investigation is needed. Another criteria was the qualifications of the researcher. In some cases, the physicians were not qualified to work in the field of stem cells. For instance, the founder of the California Stem Cell Treatment Center is certified in urology and urologic surgery, which does not relate to stem cell treatments for arthritis. Another indication of legitimacy is an understanding of how the stem cells are used to treat disease. Some clinics claimed that using mesenchymal stem cells derived from fat would be able to treat arthritis. However, due to a limited potency of adult stem cells, it is important to recognize that clinics that claim these cells can be used to treat a variety of ailments, like the California Stem Cell Treatment Center, are being misleading. Illegitimate clinics often classify their procedures as a drug with less regulation. The last criteria is evidence of an experimental design, including a control group and clinical data-based follow-ups. Clinics that claim results due to patient surveys or testimonials are often misleading, as they do not show that a difference actually occurred and that perceived relief was not due to the placebo effect. For example, a clinical done by the California Stem Cell Treatment Center claimed that one way that the treatment would be measured was by a subjective pain scale. Lastly, the procedures should be classified correctly under FDA standards. Another company, RegenX, was recently involved in a lawsuit with the FDA regarding classification of stem cell treatments, calling into question its legitimacy.
Of 29 total active but not recruiting, enrolling, or completed clinical trials for arthritis, 20 appeared to be legitimate, while 9 were deemed illegitimate. Listed in this slide are the clinics or locations that appeared illegitimate when judged according to the criteria that were developed. In these cases, the clinical trials were usually sponsored by private, for-profit clinics or treatment centers. The doctors were not necessarily qualified to administer the treatments they promised. For instance, one of the directors at the California Stem Cell Treatment Center, Dr. Elliot Lander, was board certified in urology and urologic surgery and did not have adequate qualifications to perform stem cell research. These clinics promised unrealistic results and applications of stem cells that did not meet FDA regulations, such as extracting fat tissue and treating it with enzymes before injecting it back into the patient to decrease inflammation, like in the case against RegenX. Often, there was no clear evidence of experimental design. Many relied on subjective pain scales or patient testimonials, as seen on Scott Medical Health Center's webpage. Lastly, like in the case of RegenX and Regenerative Sciences LLC, these treatments did not follow FDA regulations for testing before administering the treatment.
This clinical trial is titled The Effect of Adipose-Derived Stem Cells for Knee Osteoarthritis and is being conducted under Dr. Jason L. Dragoo, with funding from Stanford University. The clinical trial is in Phase 2, as the researchers are looking to determine the efficacy of the treatment. The trial is also expected to enroll approximately 100 participants. The trial is designed to test the efficacy of implantation of unaltered mesenchymal stem cells into the knee joint of patients with mild to moderate knee osteoarthritis. The trial is double-blind, and one group of randomly selected patients will receive the surgery along with the transplant of mesenchymal stem cells into the knee. Another group will receive the surgery but will not receive the transplant of cells. Since the study is double-blind, neither the researcher nor the patients will know who is in which group. The clinical trial began enrollment in January of 2017 and is expected to be in May of 2020. The identifier code is NCT 03014401.
Metro Health Medical Center, with the support from the National Institute of Arthritis and Musculoskeletal and Skin Diseases, is conducting the study. The principal investigator is Nora Singer, MD, who has clinical experience in pediatric rheumatology, rheumatoid arthritis, and rheumatology. She is also a professor at Case Western Reserve University School of Medicine. The study is still in phase 1, and the investigators hope they can help patients with rheumatoid arthritis using stem cells in a safe and efficient way. The 20 patients participating in the study must have moderate to severe symptoms of rheumatoid arthritis after being on the drug methotrexate for 12 weeks. The patients will be randomly split into different groups that have different dosages of mesenchymal stem cells, which are multipotent cells that can differentiate into cartilage cells and can help reduce inflammation and promote tissue repair. 5 patients will receive 2 million
parts per
kilograms of MSCs, 5 will receive 4 million
parts per
kilograms of MSCs, 5 will receive 6 million
parts per
kilograms of MSCs, and 5 will be selected to receive a placebo infusion. The MSCs will be infused into the patient. There will be multiple appointments and calls with the patients to check if their immune system is accepting the cells, the patients are safe, and if the treatment is actually reducing symptoms of rheumatoid arthritis. The last scheduled appointment is 52 weeks after the initial infusion of the MSCs. Findings are currently not published as a scholarly article because research and trials are still being conducted. Results are not estimated to be finished until December 31st, 2019.